Hey everyone, it's Dr. Alessandro. Welcome back to my channel. In today's video, we're going to be talking about dentures. Now, what do dentures represent? Patients will ask us, hey, doc, what are plates or dentures? And I'd really like plates or dentures. What I'm going to tell everyone watching, all you guys who are curious about dentures, and hopefully you haven't gotten to that point, is that dentures really represent the worst possible scenario that you can have. Think of dentures as free-floating pieces of plastic in your mouth that are not anchored, that basically you're hoping that you have enough bone on the remaining upper and lower jaws to hold them in place. So to me, dentures represent the worst possible scenario. So for example, in terms of grade of satisfaction, if you want to make it like a school grade type of thing, with A being awesome and F being a total failure, your best possible or best hoped for outcome with dentures is a C. Okay, so you're going to have mediocre satisfaction. All right, it's going to be average. That's the best possible outcome if everything goes right. Frequently, what happens is upper dentures are okay because we have on our upper jaw the roof of the mouth, which is bone. So that bone, that area, that solid kind of anchor or foundation can support an upper denture because we have bone right up here. So that makes supporting the upper denture much easier. The lower denture does not have that luxury. Lower dentures have the tongue in that same spot. What is the tongue? Well, the tongue is a big muscle that moves things up and down. And so all the tongue does is it tends to flip a lower denture up and down. So that said, a lower denture is extremely unstable. Those are the ones that typically work the worst. That is, they don't work at all, or they're not satisfactory, or they're constantly being adjusted. And they just don't provide anybody with any benefit that I can think of whatsoever. In my time, in my 19 years of seeing patients, I've seen one lower denture be satisfactory, actually have a patient happy with a lower denture. One person in 19 years. So if you think about the number of people I've seen every single year, and I've only seen one that's been happy with a lower denture, that really should tell you exactly how bad lower dentures are, and that you should be doing everything you can to avoid a lower denture. I'm going to repeat that. You should be doing everything you can to avoid a lower denture. Now, that is not supported by implants. Now, we're going to talk about that in another video, but just your plain old dentures with no implant support are, to me, the worst possible scenario, with the lower denture being the absolute worst possible scenario. So if I'm going to talk with a patient who is considering dentures and has maybe some upper and some lower teeth, I'm always going to emphasize to the patient, keep your lower teeth. Do whatever you can to protect and keep your lower teeth. You have a much higher chance of having satisfaction with an upper denture as opposed to a lower denture. So that said, by all means, dentures are an option to replace your missing teeth. So that's always an option. It is not something that can be removed from the table. You should always consider dentures if your teeth are in that bad a shape. We are hoping not. We're hoping that you're taking all your preventive measures and brushing and flossing and keeping things clean. Dentures are always a measure to replace missing teeth, but they really should be the absolute last resort. That is, only if you cannot afford anything else and you have no other options. And it's pretty rare these days. These days, with the amount of dental information and education and even advertisements and promotions, teeth, for the most part, should be staying pretty healthy overall. Only in rare instances do we really see somebody who doesn't have a shot at keeping teeth. And so whatever you do, please, by all means, try to keep your teeth, try to keep them clean, try to keep them healthy, try to avoid this as best you can. They are an option, but they're not a good one. And we want to do whatever we can to avoid getting you into these. Unfortunately, it's becoming less common, but we do want you to take care of your teeth. And of course, we want you to stay well and healthy. Thank you for joining me on this video, and hope you are staying well and healthy. And take care till next time.